Healthcare providers must be trained to identify patients who are being trafficked and exploited. 65 to 95% of trafficked individuals report interacting with the healthcare system, most commonly in emergency departments, urgent cares, and primary care offices. In this video, we will discuss indicators that a patient may be a victim of labor exploitation. However, it is important to remember that any given individual may not display any indicators at all, so labor trafficking can be very easy to miss if providers lack the awareness of this issue or do not know what to look for.
If you are a physician in this space, you are working with victims of trafficking, please take your time to listen to them.
It is also important to remember that we are not here to determine the legality or criminality of situations, but rather recognize exploitation and offer resources. We know people of all ages, genders, ethnicities, and races are victims of labor exploitation.
What you have to think about is that this is really a drive for profit, a drive for capital, and using people and their labor or services or their bodies to make profit for others. And so when you think about that and you think about who might be vulnerable, think about people who are denied access to systems of care and protection, people who are more made to be more vulnerable in many instances, people who are vulnerable to the social drivers of health or the social determinants of health, people who are low income, people who have language barriers, people who have differential statuses, immigration statuses, whether they're here undocumented or with different visa statuses, which provide different access to systems of care and protection here in the United States.
The most common one that I've seen and has come up significantly in global reports, including from the United Nations, UNICEF, is poverty. If people have any kind of insecurity, for food, housing, medical needs that can't be paid, debts, then they're more susceptible to precarious labor.
Due to structural racism and its pervasive effects, people of color are disproportionately in precarious situations and at risk of trafficking and exploitation.
Race does provide, and racialization does historically provide vulnerabilities to trafficking, whether in terms of the historical exclusion from building wealth, whether it's from the historical exclusion from owning property, whether it's redlining or the selective use of eminent domains in communities of color. These kinds of ways prevent people from building wealth, and that exclusion predisposes or creates vulnerability for people to being exploited.
Victims of labor trafficking often present to a healthcare setting with occupational injuries and illnesses related to the industry they work in.
People are exploited because of their situations in different kinds of industries that are low wage or industries that are high danger or industries that rely on immigrant labor, right? And so when you think about these kinds of industries, you can think about repetitive motion injuries. You could think about injuries in industrial settings. You can think about chemical exposures or occupational safety hazards.
Victims may also present with illnesses associated with poor living conditions and lack of access to healthcare, such as malnutrition, respiratory illness, dental problems, or inadequately treated chronic conditions.
I've had a lot of situations where it could look like a labor injury, like guys that have fainted, in Texas with the heat, guys that were on roofs and fainted and fell. And, people thinking right away like the heat stroke or sleep, but they hadn't been on their diabetes medication, for a while because they couldn't go to the doctor and they couldn't afford it or anything.
Labor trafficking victims also present with common problems such as headaches, chronic back pain, joint stiffness, and psychiatric illnesses such as depression, anxiety, and PTSD. There are other indicators aside from a patient's chief complaint to be mindful of. These include a patient being accompanied by someone who takes charge of the visit, not allowing the patient to speak or spend time alone with their healthcare provider. This overbearing individual may insist on interpreting for the patient or being present to help explain things more clearly to the patient.
Day workers, day laborers, or contract workers and employees, they may be using healthcare as a last line of resource. This may be one of the last resources that that worker may be utilizing, because they want to limit being tracked or being limited by disappointing or angering their employer. Unfortunately, there may be instances, depending on the type of industry, where the employer, him or herself, or the third-party contractor may accompany a worker to a healthcare facility. So for those individuals, having one-on-one interactions with the doctor or the nurse practitioner may be limited.
Be observant of a patient's behavior, as this alone may be a sign of trauma. This includes a patient being fearful, anxious, defensive, closed off, or generally distrustful of a medical provider.
For labor exploitation, really what's going to come out is during our occupational history, our social history, our family history, doing our sort of depression screens or anxiety screens, are really paying attention to the behaviors of the patient. You know, when patients are coming in and they're very scared about their employment situation, or they don't want to talk about it, or they're telling you, or you ask them about what their schedule's like, what their life is like in their workplace, or what kind of work do they do. And then you ask and you have a conversation more about what is their experience like? Do they have breaks? Are they paid fairly? Do they think they're being treated fairly at work? You know, these kinds of things come out, and I think that's where you're going to find a lot of the labor exploitation.
A lot of the time, us as forced labor, as foreigners, we don't understand the rules and laws and regulation, and we're scared. Like when we come into the medical thing, we are scared. And, you know, especially folks from another country, our documents are being taken away.
Having a private, informed conversation with your patients about their jobs provides insight into working conditions and potential exploitation. Providers should ask questions privately, away from anyone who may be accompanying the patient. The use of certified interpreters rather than the patient's companion is imperative. It is also crucial to discuss confidentiality and the limits to confidentiality based on mandated reporting and other local reporting laws. It is often helpful to have an institutional policy that all patients are seen alone for part of their visit, so providers can point to this policy in cases of resistance. Some prompts that may guide your conversation with patients include, tell me about your job and what you do. Do you feel safe at your job? Has anyone at your work ever hurt or threatened to hurt you or your family? Are you provided equipment to keep you safe?
How do I approach the questions of if I'm concerned that a patient is being labor exploited? Well, first of all, I'm going to have a conversation with the patient. What do they think about the situation? What is their situation like? What is their workplace like? Are they scared? Do they feel like they're being treated fairly? Do they feel like they can leave? Are there documents being held by the employer? That's another way that that traffickers or exploiters use patients. They hold their identification or documentation papers.
It is also important to ask about physical and sexual assault in the workplace, threats of violence, or other forms of coercion.
The vectors of violence all overlap. So you're going to assess the patient. Are they having any other kinds of abuse or violence through this labor exploitation situation that you as a physician or healthcare professional are concerned about?
Fear is instilled from the early set of an individual joining that workforce to the very last day of that individual's day of employment. That use of fear of deportation, fear of maybe threats or coercive acts to that individual or their individual's loved ones are the two types of, are the areas where that individual is going to have the utmost control of that person. So coupling fear with withholding somebody's money, right, or stipends or payments or paychecks, that individual feels that they have no choice but to submit to this trafficker.